Now, there have been some reports of some people testing positive for COVID-19 even after being vaccinated. The general perception is that vaccines protect people from infection. Let's expand this further with Professor Mosa Moshabela, the Dean and Head of the School of Nursing and Public Health at UKZN. Professor, thank you once again for your time this afternoon. You would have heard towards the end of last week the Gauteng MEC for Health, MEC Mokheti, having been diagnosed with COVID-19, even though she was part of the vaccination drive a little bit earlier on. I guess the question that many are asking is, how does this happen and why?
Yeah, no, indeed. Good afternoon to me and to the viewers. I think it's a very important question to ask, and I was actually under the impression that this was explained adequately previously when we started talking about the vaccines, but maybe it is worth going back. The vaccines, when they are given, they are intended to boost the immune system. So they boost the immune system such that they can work at, in my view, 3 levels. The first one is, when someone is exposed to an infection, the extent to which they can be infected. Because they boost the immune system, they don't prevent infection. A person can still be infected, and the immune system, because it's been boosted, it can respond to that infection. In some instances, that infection may not necessarily result in disease or symptoms. In some instances, it might result in mild symptoms. But there's a second level that's important. You would have heard that we talk a lot about severe disease hospitalization. The most important thing is that the vaccines that we choose can protect everyone who is exposed from suffering from severe disease. And in some instances, we will say efficacy from severe disease is 80%, 90%, and so forth, which means that a small proportion of people might still suffer some sort of severe disease. But the last part is protection from death. And so in these cases, we are saying all the vaccines that we have must fully protect people from death, and that is 100% protection. So it is at those 3 levels that we look at these vaccines, and as a result, it is possible that people will still be exposed to infections, and it is possible that some might still have some symptoms, but we expect that most people will not have severe disease, and nobody should be dying from COVID-19 after vaccinations.
So I guess in summary, really the vaccine is there to ensure that lives are saved, to prevent hospitalizations, and to make sure that even though the virus may be found in your system, it doesn't have a fatal effect on the individual. But what we're also seeing here, Professor, is that one can still spread the virus after having taken the vaccine. Break this down for us.
Yeah, so that's the next part. So in general, at an individual level, we expect to see these outcomes, as we have discussed, that one may still be exposed, but because they've got a strong immune system, they can respond really well to the infection. But because you can still carry the virus, even when you don't have the disease, you can touch surfaces and so forth and spread it. But also, if you are infected and you've got mild symptoms, you can still kind of breathe in a room and spread it. It's still important for us to have precautions and prevention so that we don't expose other people who do not have as strong an immune system like the person who's been vaccinated. So if you've been vaccinated, you might respond well, not have major problems, but the next person may not be as safe. However, over the long term, we expect that the more people get vaccinated, it means that fewer people can spread the virus, especially when we now think of people who could be breathing out the virus. And the more people get vaccinated, then we start to see the infections even increase, mostly because of herd immunity. But I see that as the secondary priority or secondary objective after we've protected people from death and severe disease. And that you only benefit from that when you start to have a large majority of people vaccinated because of population herd immunity. That's how we look at it. But infections can still be transmitted. It's just that because most people are protected, they don't get infected, they don't get too sick, then you reduce the chances of infection spreading.
That's a very important point, Professor, that you've highlighted there, because there have been questions asked of those who have taken the vaccine that why do they still need to follow all the safety precautions even though they've taken the vaccine? They still need to wear their masks, they still need to sanitize, and as you've put it, that's really to protect others, that they do not infect others.
Yeah, so you'll see that at the early stages of the vaccination rollout in any country, they will still emphasize protective and preventive measures. But the moment they feel that there's a great coverage of vaccination in their population, they can start reducing some of those restrictions. In my view, I think that one needs to manage that carefully, especially in the context that we have where we've got new variants. Because the new variants also start to play a role where you might end up with more breakthrough infections because of the new variants, because the vaccine that you've been exposed to may not be as efficacious against those variants. So that, for me, I think that it's a policy decision, but in principle, I think that the more people start to have coverage of vaccines, then, you can start to feel a little bit safer collectively and start to reduce some of the restrictions. But in the early stages, Tammy, I think it's really important that we continue to maintain those preventive measures in full.
You mentioned there, Professor, the different variants. This has been covered in previous conversations, but I think it's worth mentioning now once again. What would be the differences in exhibited symptoms based on the type of variant that one contracts?
So currently, Tammy, we don't necessarily have distinctions in terms of symptoms. What we are often worried about is whether any of the variants would cause more severe disease than other variants. We don't yet have evidence of that. Most of the variants, what we know is that they can basically transmit easily. And in terms of infecting more people, but not necessarily cause more severe disease. So that much we know. We also know that some of the variants, including the one here in South Africa, it may have the ability to escape the immune system, which means that you may still have breakthrough infections, even though because once people are vaccinated, we expect that it's unlikely to cause severe disease. So those are the things that we are worried about. When we monitor these variants, we monitor them for transmissibility. We monitor them whether they cause more severe disease. We also monitor whether they escape the immune system, which means that they can still cause disease even when someone is vaccinated. And those are the things that would influence the responses, both from science and also from policy.
What do we know, Professor, about the after effects of vaccination? We had DENOSA complaining about nurses being suppressed, being told by, well, at least some nurses being suppressed and being told not to talk about the type of side effects that they might have after having taken the vaccination. Give us more information about that, please.
Yeah, I think that those are, for me, I see that as important information that is coming from the ground. I don't think that it's a policy decision. I think the policy decision is that everybody needs to report the adverse events. And in fact, there is that med safety application that's been released. And it's unfortunate that, we don't talk enough about this, but it's important that everyone reports all the side effects. And the side effects or adverse events can be classified into those that are directly linked to the vaccine, those that are coincidental, and those that may be linked. And so the expert committee that looks at adverse events would then evaluate all the case reports that are submitted to them. But there is nothing that prevents anybody from reporting, especially if they get onto the app or if they complete the form. It's just that I think that perhaps the information we are receiving on the ground has to do with the fear of adverse events. And so and the discouragement may be related to that. But I don't think that there's any policy or scientific reason or health service related reason for people not to report. In fact, it's more important that people report even when they think that they are minor events, especially because there may be a need, for example, if there's harm, that people can be compensated, monitored, and they can receive interventions early rather than late.
Would it be too simplistic, Professor, to say that the vaccination is actually an immune booster?
Well, that's a good point. I think that that's a good point. In a way, I think that you are right. I think that it does really boost the immune system to be able to fight off the infection. I just don't know what people would interpret as an immune booster, because then people might have their own understanding of what an immune booster is. But really, I think vaccination is about prevention. It's about preventing people from diseases, either infection or severe disease or death. So that's how I would look at it. And also, likewise, it does not treat an infection. So I think that you are, I think, getting into, the right, you're beginning to use the right terminology that people can understand better. But only if people understand the immune boosting aspect the way that we understand it from a vaccination point of view, and not in other ways that people may have used in the past.
Professor Mosa Moshabela, thank you once again for a really insightful conversation, some really important information there that we all really need to understand and decipher. He is the Dean and Head of the School of Nursing and Public Health at UKZN.